The numbers are extraordinary. In 1994, one suitcase of medical supplies carried by Segundo Velázquez to his brother Jose, a pediatrician in Bolivia. By 2013, 3.5 million pounds of supplies shipped by Mano a Mano international partners in the United States to counterpart Mano a Mano organizations in Bolivia. 47. The number of schools replaced by Mano a Mano with new schools, most with teacher housing. 6 major water reservoirs and 153 smaller reservoirs. The reservoirs capture water for drinking and irrigation for thousands of Bolivians. Crop yields have soared. 900 miles of roads, distances to market measured in days, have been reduced to hours. 4 airplanes. Mano a Mano aircraft carry healthcare workers to remote locations and transport critically ill rural patients to city hospitals. Behind these numbers are people. A community in Bolivia decides what is most important to it and presents a proposal to Mano a Mano in Cochabamba. The community, the local government, and Mano a Mano sign an agreement spelling out their respective responsibilities. The community's contributions include land and all unskilled labor. The local government contributes funds for construction and operation. Mano a Mano raises funds for each project from donors in Bolivia, the United States, and Europe. It provides project design, skilled labor, and heavy machinery, equipment, and supplies. Donor contributions are memorialized on every project. A few more numbers. 137, the number of health clinics constructed by Mano a Mano in Bolivia's mountains, plateaus, and tropics. At the dedication of each clinic, the agreement among the parties is affirmed and keys handed over to the community. 700,000, the number of Bolivians served by those clinics. 94%, the amount by which Mano a Mano clinics have reduced the infant mortality rate. 100%, the percentage of projects built by Mano a Mano still in operation. The contrast between other initiatives and the community-initiated Mano a Mano projects is dramatic. USAID. The government of Bolivia. The U.S. Department of Agriculture. To learn why Mano a Mano built clinics have been so successful, 2 volunteers from the United States recently spoke with clinic doctors, nurses, and dentists at continuing education classes hosted by Mano a Mano in Cochabamba. Dr. Alberto Vilcayes Flores and Dr. Oscar Quito Sombrana work in Pocona, 90 miles from Cochabamba. 15 clinics in the Pocona district serve 13,500 people in 86 communities. Dr. Vilcayes, son of a Potosí miner and the first doctor in his family, explains that 8 of the clinics are single-room adobe structures with little medical equipment and therefore limited ability to serve patients. He contrasts them with the 7 cement and tile clinics built with Mano a Mano. The Mano a Mano clinics have rooms dedicated to specific functions, examination, inpatient, and labor and delivery, as well as bedrooms, bathroom, and kitchen for the medical staff. Mano a Mano clinics are well equipped, Dr. Vilcayes says, and well maintained because the community helped to build them and has taken responsibility for operating them. Patients at these clinics receive superior care. Medical staff find their work more rewarding, their living conditions satisfactory, and consequently choose to continue working at the clinics. Lower turnover means better continuity of patient care. Dr. Quito, the grandson of farmers, supervises the 15 clinics. He explains that the old hospital in Pocona was a converted two-story house. To reach inpatient rooms on the second floor, a woman in labor had to climb steep steps. A patient on a stretcher feared he would fall. Patients requiring special care had to go to Cochabamba. Their families had to pay for travel and medical care and provide food for the patient. Their money exhausted, many poor families were left no alternative but to sleep on the street. Dr. Quito explains that the community, the municipality, and Mano a Mano together built a new hospital. 3 times the size of the typical Mano a Mano clinic, the hospital has an efficient arrangement of examining rooms, inpatient rooms for new mothers, men, and children, rooms designated for surgery, labor and delivery, dental care, and a pharmacy. The community of Pocona supplied labor, 6 workers each day from 8 to 6. The municipality and Mano a Mano donors shared the out-of-pocket cost of $95,000. At the dedication, Mano a Mano turned over the keys to the community. The salaries of the medical staff will be paid with government money. The national government will supply vaccinations, some medications, and free services for expectant mothers and children up to 5 years old. In Chilichi, Nurse Fidelia used to live and work in this one-room, dirt-floored clinic without bathroom or running water. She remembers one long night in the single room, caring for both an intoxicated man and a woman giving birth. She now works and lives in this multi-room Mano a Mano clinic. The well-equipped clinic inspires the confidence of its patients, Fidelia says, and attracts many more patients than the old. 23-year-old nurse Jovita Orellana Harada speaks both Spanish and Quechua and is the only full-time staff person at the Cayarani clinic. She lives at the clinic with her 6-month-old son and her 5-year-old nephew, whose parents, like many Bolivians, have gone to Argentina to find work. Jovita's clinic serves 7 communities with a total population of 2,100. 3 days each week, at 6 in the morning, Jovita leaves the clinic on foot to visit one of the communities. She carries her son and medical supplies in her colorful agallo. The farthest community, which is not connected by road, is a 4-hour walk over the mountain. Many families have 8 to 10 children. Most live in single-room houses with straw roofs and dirt floors. Jovita vaccinates children and educates their parents about health and nutrition and family planning. Like Jovita, Marta became a nurse after 1 year of classes and 6 months of practice. Her Mano a Mano built clinic in Japo serves 17 communities and a total population of about 14,000. She works with a doctor and another nurse. Like Jovita, she is on call for emergencies night and day and keeps her son with her always. Traveling in the clinic's ambulance, 2 of the Japo staff visit each of their 17 communities at least once each month. Most patients are women and children. Men are in the fields from dawn to dusk. Though encouraged to eat the nutritious quinoa they raise, most prefer to sell this valuable cash crop. 40-year-old nurse Modesta Meneses began her career in Independencia, a village 12 hours from Cochabamba. She lived and worked alone in what had been a dirt-floored, straw-roofed classroom. Wakened one night by a woman in labor whose baby was transverse, she hailed a passing truck to take her and the mother to where they could meet an ambulance. She asked the driver to stop for every contraction. The baby did not survive. Modesta says that like a gift from heaven, Mano a Mano built a bridge to her village, a clinic, and later a school. She is confident she and the doctor at the clinic could have saved the baby. Dr. Mary Linares was motivated to become a doctor by the poor care given her father, a miner in Potosi. For her, the annual acute care conference organized by Mano a Mano is an important opportunity to learn how to prevent postpartum hemorrhaging, how to treat snake bites, how to treat traumatic injuries caused by motorbikes, an everyday occurrence. The conference is another reason doctors and nurses like to work in Mano a Mano clinics. I try not to miss the conference, Dr. Linares says, because I always learn something useful. Everyone at the conference feels the same way. Mano a Mano is the only NGO that works with us without asking anything in return, Dr. Linares says. Everywhere else, it's pay, pay, pay.
Para mí, la salud es primordial. Sin salud,
Dr. Linares has worked since 2007 in the Mano a Mano clinic at Campo Víbora. Women cry with relief when they learn she speaks Quechua and can understand them. She is on call 24 hours a day for 22 consecutive days each month. We often go without sleep, she says. But without health, there's no work. Without health, there's no school. Without health, there's nothing.
Si no hay salud, no hay nada.
Demand for the clinic's services has grown. 4 medical staff have been living in clinic housing designed for 2. The single inpatient room has been reserved for women in labor. Other patients have been turned away, even when they've promised to give up the bed if needed. The nearest hospital is hours away, if an ambulance or taxi is available. Delay in treatment can be fatal. Dr. Linares remembers an infant with pneumonia that died en route. Mano a Mano recently built housing for the medical staff. Their vacated rooms in the clinic will become an inpatient room for men, an inpatient room for children, and another examining room. The kitchen will become a laboratory. Dr. Linares says the inpatient rooms will save lives. Saving lives, she says, is the best thing we can do. A final number, 350. The backlog of community proposals presented to Mano a Mano.